Hi, this is Dr. Mary Kathleen Figueroa. Thanks for coming to my thyroid channel. Today we're going to discuss 3 reasons that you should consider going to an endocrinologist if you have thyroid disease. The number 1 reason you should consider going to an endocrinologist for your thyroid disease is if you have not gotten a good explanation as to what is going on in your thyroid and what caused the disorder. Since most of the time, 85% of the time, it's Hashimoto's thyroiditis, if you already know you have Hashimoto's thyroiditis, then pretty much you know no other reason why you have hypothyroidism. If you also have hyperthyroidism and it's Graves', which is 50 to 80% of the time, then you also know why you're hyperthyroid. But if you're not sure of the reason why you're having thyroid disease or what it means or how it'll progress, one way to find out is to contact and to have a consultation with an endocrinologist. The second reason you might want to go to an endocrinologist is if your dose is not stable. If you're one of the few people whose thyroid doses are always being changed, month to month, every 3 to 6 months you're changing doses, then something is not right, and probably it's worthwhile for you to get a second opinion from an endocrinologist as to why there's such instability in your dosage. The third reason, and the final reason you might want to go to an endocrinologist if you have thyroid disease, is if you don't feel well. The vast majority of patients do quite well with thyroid medication, and the majority of thyroid patients are treated in primary care, and that's okay. That's great. There are only 5,000 endocrinologists in the entire country, so we certainly couldn't take care of the millions of people with thyroid disease. However, if you do not feel well, if you do not feel energy, if you do not feel that you can do the things you need to do, that you're mentally not as clear as you need to be, and if, for instance, you've had your thyroid taken out, which is where you have absolutely no hormone in your body and you really are quite dependent on the pills that you take because you have no thyroid, then it behooves you to find out how you might feel better, how you might feel like before you had your thyroid taken out, for whatever condition you had your thyroid taken out. So I think for those 3 reasons, it might be a good idea to contact a local endocrinologist. So we'll review again the 3 reasons to see an endocrinologist if you have thyroid disease, specifically hypothyroidism, is to find out why, to find out what is going on in your body. If you want to know more, have more education and more knowledge, then going to specialists makes sense. 2, if there are instabilities in your case with doses that are constantly changing or not able to get to a good dosage. The third is you've been on the same dose for quite some time, but you do not feel well. So with those 3 reasons, I think it's probably a good idea for you to contact a local endocrinologist for another opinion. Thanks for looking at this video. If you like it, please give it a thumbs up. If you would like to subscribe, please subscribe below. New videos every Friday. Thanks for tuning in.